Hi, everybody. Welcome to our Facebook Live. I'm Amanda Barney. I'm the AVP, the Associate Vice President of Communications and Development at Thundermist Health Center. And today I'm joined by Dr. Sapna Chowdhry. Dr. Chowdhry is an infectious disease specialist. She's also the medical director at our Woonsocket Health Center and has been very helpful throughout this COVID crisis. Dr. Chowdhry, thank you so much for being here today and answering people's questions.
Thanks, Amanda. Thanks for having me.
So I know to start, we have a couple of questions right off the bat. If you have questions, send them all on in. We're excited to get you as many answers as we can tonight. The first question that we got this morning was from Debbie. And Debbie said, "Hi, I tested positive on March 22nd, and I'm still not feeling good. Headache, extreme fatigue, body aches, and body weakness. I have tiny little bright red pinpricks and dots scattered around my body. Am I still contagious? And I know this is new, but will I ever get back to normal?" What do you think, Dr. Chowdhry?
Hi, Debbie. Thanks for your question. I'm sorry you're not feeling well. So I don't know everything I need to know about you, but I can tell you this, that usually at this stage, 4 to 6 weeks or longer past your last positive test, I'm not sure if you had a follow-up test. And if you did, most people believe that if your test is negative, you may no longer be contagious because you need to have the virus in your respiratory droplets to really transmit through any route, whether coughing, sneezing, talking, or contaminating surfaces. But you might be experiencing an unusual complication or a late effect of the virus. And so I would suggest that you call your doctor, your provider, and they will probably suggest further testing and be able to advise you. So it's a good idea to take this seriously. This is a new illness. We don't know everything we need to know about it. So everything should be taken seriously. But to answer your question in two parts, I don't think you're contagious, but hopefully you've had a second test. If you've had a negative test, it's unlikely that you're contagious, but you could still be suffering a late complication of COVID. So you should contact your doctor's office.
Great. Dr. Chowdhry, we have a lot of questions coming in. The next one's from Ashley. She's saying, "I'm wondering when I'm going to be allowed back to see you in the office." So I know and others might know that at Thundermist Health Center, we're screening patients. And if there's symptoms of, if you have symptoms of COVID-19, then we provide our care virtually via either a web visit or a telephone visit. So Dr. Chowdhry, when do you think more patients will be back to the health center?
So this is, again, another question that I'm going to say a few things about. So it all depends on why you need to be seen, right? So if your need is urgent, I will reassure you that enough steps are being taken for patients and staff safety. So with both parties, your provider, your staff, yourself, adequately masked with good hand washing, with frequent deep cleaning, which we are doing at our facility, you should feel fairly confident when you come in for either laboratory testing or visits. Having said that, I think for non-urgent visits or things that your doctor thinks can be addressed over the phone or through a video call, it is still best to stay home, because some of us could be transmitting the virus in the while we're incubating and pre-symptomatic. And so the idea is to recognize, every day I hear about someone who was just, tested randomly and felt completely well, went to Stop and Shop and there was surveillance testing going on. And then they were told they were positive, which really suggests that unless we really need to be out of the house, we shouldn't be out of the house. But if you really need to be seen, do not hesitate. The health centers have a clear plan. The Rhode Island Department of Health has instructed us, and we are all presenting them with our plans as to how we plan to reopen completely. But even now, we are open for urgent visits.
So as a mom, especially when we talk about preventative care for our children, what should we do and what should we expect?
So I say, any concerns that you have should be taken seriously, and so you should call your pediatrician, you should call your family medicine provider, whoever your child's caregiver is, because in the midst of all of this, we don't want to miss out on important vaccinations and important milestones like getting that chickenpox vaccine or that measles vaccine, because we still see some vaccine preventable illnesses out there in the community. So there is a way to come in safely, and you should be fairly confident that adequate steps will be taken. And so the first step is to call. Don't assume that they won't see you. If you have a question, pick up the phone, call the health center, call your doctor's office, and they will advise you.
That's good advice. Thank you. We have another question from Danielle. Danielle says she's concerned about the new virus that is affecting kids that we all keep hearing about in the news. She said, have you seen anything like that in Rhode Island yet? And should we be worried?
So, so this is a tough situation, and, very experienced clinicians feel very cautious about this illness because we are still unraveling the extent and complexity of this disease. And so the first part that I will say is, yes, there have been cases of that, vascular type complications that are associated, and there may be kids in Rhode Island who are sick with that. As far as I know, they are okay. They may be hospitalized, but they're stable. And what was the second part? I mean,
is there anything special we should be doing with our children?
We should all be listening, to the CDC recommendations, and, washing our hands and covering our mouths, and nose so that we can protect others. So eventually it comes down to, we all need to mask for everyone else. When you wear a mask, you're really not doing it for yourself. You're doing it for your old grandmother, for your child, for your immune compromised uncle, so that you don't unknowingly infect somebody who could be a high-risk individual who can have a really serious outcome from that.
Great. Well, we have a lot of people who have joined us tonight. We have a lot of questions. So our next question says, this is from somebody who says they have Hep C. So I know you help to take care of a lot of our patients who have Hep C or are living with HIV. Are there any special considerations for those patients?
So, hepatitis C. So again, I'll break that down into two parts. So hepatitis C treatment has become so easy, effective. We have been doing new starts and completing treatment through this pandemic, actively treating. Okay. So hepatitis C itself doesn't usually cause much immune compromise, but if someone has had hepatitis C for a very long time and have been told that they have cirrhosis or advanced liver disease as a result of untreated hepatitis C, then they would be considered immune compromised. And the same thing will apply to HIV. So most people believe that at all immune function, you are somewhat immune compromised, but most people also agree that if your T cell count is over 500, you have a fairly competent immune system. So just having HIV doesn't necessarily mean you're immune compromised. You should take extra precautions, but you should be especially concerned if you've been told that you have advanced HIV, where your T cell count is less than 200, which is defined as AIDS. So again, for both diseases, I would say it depends on what stage of the illness you're at. And I continuously, through this chat, will continuously talk about universal precautions. That's how we've stayed safe in the medical field. And that's how the world has to be at this point for yourself and for your loved ones.
Thank you. Someone's asking about the availability of testing, and is there testing at Thundermist?
Oh, yes, absolutely. We have the ability, I think, to test 60 or more, and capacity is building. On an average day, we've been testing anywhere from 50 to 70 people, including our Woonsocket and West Warwick location. And basically, all you have to do is call. And, there's some screening that occurs over the phone, and that happens everywhere, regardless of what facility you choose to get testing at. Testing is becoming more and more accessible and available, and we should not hesitate to contact and be tested if we think we have a symptom that could be COVID related.
Hi, Michael. Michael brought up some questions about wearing masks. And I know this is something that we have been talking about at Thundermist, that some patients do have trouble wearing a mask. They find it claustrophobic or so Michael's saying, is there a better mask that I can wear that makes it easier to breathe? He does have COPD. How can we help Michael with wearing the mask?
So this is a question that every provider is getting asked multiple times a day. We're getting phone calls from anxious people or people who already have difficulties with breathing, and it's an uncomfortable, unnatural feeling. I don't like it. No one enjoys wearing a mask. But remember, you really only need to cover your nose and mouth. So it can be a face covering, like a bandana or a cloth that could be open at the bottom, so you have a little bit of airflow going. So there are different categories of masking. So there's the surgeon who's operating, or someone who's in the emergency room, or the EMT guys. They need the good old fashioned N95, maybe a surgical mask on top of that, because they may be treating someone who's actively infected and want to protect themselves. For the layperson, for someone, if I'm out for a walk, all I need to do is cover my face, cover my mouth and my nose, so I don't expose someone to my germs if if I don't know I'm infected. And so one way to deal with that would be to do a cloth covering that doesn't restrict your face, and also to try to practice. I always say in low stress situations at home, walk around and figure out what's your most comfortable position, where you like the mask to be. I definitely don't approve of people who lower their mask with their nostrils showing and only their mouth covered. I mean, that's not the worst thing you could do, because really you release the maximum amount of respiratory droplets when you talk. But the sneeze can be really, really lethal. I mean, you can send COVID 12 feet away with a really vigorous sneeze. So we really have to keep those nostrils covered too. But as long as it's covered, it doesn't have to be restrictive. And sometimes if you can just kind of figure that out, what's your comfort zone, you may want to try it at home before it's time to leave the house.
Are there people who shouldn't wear masks? So Michael has COPD. Is he in a category of someone that should not wear a mask?
I don't think so, because, well, ideally high risk individuals are supposed to not leave the house, right? So are they masking because there's other people in the house? It's like the question is something that I'm, obviously people have to go get food, go get, medication from the pharmacy and so forth. So no, health-related conditions. I mean, there are age groups that are exempt, right? Children under a certain age group do not need to be wearing masks, because, but other than that, I think everyone should. You just have to find what you can tolerate.
I'm sorry, I just lost our place. Oh, Amy's wondering when do you expect that we'll be testing every Rhode Islander?
So, well, the testing capacity is exponentially growing, right? And as we go through the phases of reopening and schools and public places and places of worship and surgical suites and everything start opening up, there will be more and more situations where a lot of testing will be required. And as we have more and more testing available, as this has already happened, Amanda, you and I know how difficult it was to get a test just a few weeks ago and how much easier it's become now. And so every day it's really a matter of capacity and PPE, right? Because the person who's testing you has to have all the gown and the face shield and all that on. So those are the limiting factors. Once we have figured out, and every day something new is happening, and so innovative ways of testing are coming by, there will be a time not far in the future where anyone who wants to be tested should be able to get tested. We're not there yet, but we're getting there. That's our goal. Because this is what I say. If this is not a fun test to have, so if someone's asking for a test, there's a reason. And then that's the way I feel about it. So I really dig deep and ask the question, and never just say, oh, you don't have symptoms, you shouldn't be tested. There's always more to the story. And again, that brings me back to call your doctor, call your provider, or call a clinic near you if you don't have a PCP, call a respiratory clinic near you. There's also walk-up facilities, right, in Central Falls and Pawtucket, where you can actually walk up and they'll do the screening questions. And if you have a good story, if you have a good reason why you think you should be tested, you'll get tested.
Good. You mentioned about the test. I know it's uncomfortable. Can you explain to people what they should expect with a test?
So I've spent a few afternoons in the respiratory clinic, doing the test on patients, and really the idea, it's a very and for different people it's a different level of discomfort, but really if you stay still, it's 10 to 15 seconds and it's over. It could be less than that, depending upon how quickly or how many tests someone has done and what their own efficiency is with it. It's not painful, but it's just uncomfortable. It's not natural, right? For something to go that far up your nostril, it's going into your nasopharynx, which is literally behind your nose. It's a very, very thin and very delicate swab. So it's really not something that can injure you in any way unless you struggle, which I think if you prepare the patient properly, there shouldn't be. That shouldn't happen. So yes, it is a few moments of discomfort. I'll put it that way.
We got another question in about our dental services, and people are wondering when they're going to be able to make an appointment at Thundermist Dental. I can let folks know that we're having those conversations actually every day this week. We've had conversations about reopening dental. We're working on a plan that would allow us to reopen our dental services, or at least most of them, in a way that keeps you, our patients, and our employees safe. And we expect to have a lot more information on that in the coming days. So keep an eye out. We know that many, many patients are going without needed dental services. So we want to get that back on track as quickly as we can in a safe way.
And again, this would be another situation in which you may still want to call your own provider's office. I mean, sometimes a PCP can at least initiate some antibiotics or something if they think that you may have like a dental abscess or some kind of infection going on. So there's different levels of care that people need for their teeth. They're all important, but if you're behind on your cleaning, I would say take a deep breath. It's going to be okay. But if something's really wrong, urgent cares are open, walk-ins are open. Your own doctor could be a resource. So we should take things like that seriously. Dental infections can lead to serious complications. So if something like that is going on, do call your provider's office.
And Thundermist is open for urgent dental visits, which really means anyone that's in pain can receive services at Thundermist. We'll do what we can. They're providing both in-person and virtual visits in dental for urgent visits. So definitely call.
Yeah.
Amy's wondering, is there any real known precautions besides the mask and social distancing? Is there anything else we should be doing?
Really, hand washing. There's only two ways, really, if you think about it, that the virus can spread. Either through respiratory droplets or someone's respiratory droplets on a surface, whether it's a doorknob or a surface or something that you bought, from the store. And different people are taking different levels of precautions. People do suggest that you wipe down your groceries and maybe wash your produce a little bit more than you used to in the past, just in case someone had handled it before you, because the virus can live on inanimate objects for a while. So, other than that, outside of healthcare workers, I think someone out in the community, if they take these two precautions, they should be fairly confident that they are doing the right thing to keep themselves safe. And who are you around, right? Limiting your social interaction, your bubble.
Mm-hmm.
It's the new term, right?
Keep those networks small.
Yeah.
I have a question that occurred to me today. I went out to run to get a curbside pickup order at Target. Actually, my daughter wanted a hula hoop. Mm-hmm. So I put on my mask when the person came up to my car to give me my order. And I wondered, that was really fast. Do I need to wash that mask now? How do we store what's the best way to store our cloth masks? Where do the risks of cross-contamination come into play?
Well, a cloth mask, of course, can be washed every day if you've used it. But then remember, Amanda, you put your mask on for the Target employee, not to protect yourself.
Right.
So unless you were coughing, sneezing, or having a vigorous conversation with them, you know if you soiled your mask or not. And if you're fairly confident that that didn't happen, then you can use it again. Even in the healthcare field, masks are reused nowadays. We conserve PPE, as long as we know that we don't go room to room spreading germs. But if it's you who's using the mask and continuously using it, then we do try to prolong the use. The surgical masks are used and reused sometimes, depending upon what you did while you had them on. The cloth masks should be washed frequently, and that's why we encourage people to get those, because it's actually easier to keep those clean than the surgical masks.
We have some people asking about whether or not we're accepting new patients. We are starting to accept new patients at all three of our sites. So Woonsocket, West Warwick, and Wakefield. So if you need a new patient appointment, give us a call. We'll get you in as soon as possible.
Agreed.
I'm just looking. Oh, Jay's wondering, do you know when antibody tests might be available?
They are available. They're not freely available, but they're available in private, through private labs in a study setting. I'm not entirely sure if insurance will pay for an antibody test without a reason why, So out of curiosity, if you want to know whether or not you were infected 1 to 3 weeks ago or longer, I'm not entirely sure that that test will be covered. But there are private labs that are offering those tests. But when you call your provider for such a test, then they will have a conversation with you about what does it mean to have a positive antibody test. So the COVID-19 is one of the coronaviruses, but other coronaviruses can make the antibody test show up positive. So if your goal is to try to become a donor for convalescent plasma, unless you had a previous positive COVID-19 test, you cannot really be a donor at this point, because they don't know if your antibodies are COVID-19 specific or other coronavirus. We also don't know if having antibodies means you can't get it again. We also don't know that if the antibody is actually protective, how long does it really keep you protected? So every time my patients ask me for an antibody test, I ask them why. Why do they think they need an antibody test? Because there's obviously a huge role that convalescent plasma is playing. It's saving lives, but that's for a very specific subset of patients who tested positive. A certain number of weeks have gone by, and in a clinical trial setting, in a structured setting, there's a big role for antibody testing. But outside of that, I'm not sure if it's something that's covered, and I'm not really sure for a otherwise well healthy person what would be the relevance of getting that test.
Okay.
And because it's fairly new, it's also not 100% reliable at this point.
Michelle asking, would it be helpful for healthcare workers to have antibody testing?
And I say the same thing again for that too, because again, without knowing what's the relevance of having an antibody, whether it's protective or not, and how long does it keep you protected? Because the last thing you need is to get a positive antibody result, and then that means it's a get home, you get out of jail free card. It doesn't mean you no longer need to wash your hands or social distance, because we don't know if you can get infected again.
Chris is asking, what should workers who are going back to the workplace do to stay safe?
So ideally, you want your employer to be able to share their plan with you as to, how is your office or your workplace adapted to keeping you at a safe distance from others? Do you have personal protective equipment for whatever your job is? Because every job is different. And so if you're working at a computer terminal by yourself in an office, that's a whole other level. And then if you're in an assembly line, is enough distance between you and the other employees? And whether if you have a mask, that's great. Is your employer going to provide a mask? Really? So as long as there is and again, the Department of Health is asking, as we reopen, for every employer to provide them with their reopening plan, which is going to include that, right? How to keep people safe at work. And so ask that question of your employer. Is there a plan? And maybe they'll share it with you, and that'll help you, because ultimately the goal is again the same thing: frequent cleaning of frequently used surfaces, hand washing, lots of hand washing, and mask and social distancing.
Great. We've gotten a couple of questions. So Chris is asking if it's safe to work outside. A couple of people have asked, is this in the air? Can I catch it? If I hang clothes out, will my clothes become infected? How can you and can't you get this?
Yes, I mean, I had looked at this yesterday, and it was more about, walking outdoors. If I'm going for a walk outdoors, do I really need a mask? There isn't a one answer to this question. There isn't a one single answer. It really depends on your situation. If you're going to be walking outside and it's an isolated area and no one's around and you don't want to put your mask on, that's okay. But not if you're passing people at every 6-foot interval. So it's not like because you don't, if they're talking while they're walking by you or coughing while they're walking by you, it might be a good idea to have your mask in your pocket at all times. But if you're fairly confident that you're by yourself, it's usually not in the air in a not busy area, right? But if it's a heavily human trafficked area where people are walking, it's a heavy, there's heavy traffic, foot traffic, then you may want to keep your mask on, or at least have it handy for when you pass somebody. Now, the clothes question again, where is it? Are people walking by? That may be something that I would be concerned about. But if it's your own backyard and no one else is around except your family, you're okay. It's not going to travel in swirls of air and get to you. It doesn't go that far. But if people are walking by your clothesline, then you may want to be concerned.
What about products that we're burning in the house? Mm-hmm. So I know a lot of people are sanitizing their groceries outside on their front stoop before they bring them in the house, things like that. Are those things that people should be doing?
People are doing those things. That's true, because there has been a study, and it was published in the New England Journal, kind of showing how the virus can survive on different surfaces: cloth, plastic, hard surfaces, and a lot of grocery bags are plastic. If you have gloves on and you just empty your bags and get rid of them, then you don't need to wipe those, but the groceries have been handled too. So then again, the next conversation comes, we always encourage people with high-risk conditions to protect themselves, but then every so often you'll hear about a younger person who got sick and very sick. So I feel like everyone can use a bit of caution here. So there's lots of YouTube videos where people will show you how to unpack your groceries, on a table. Just kind of put a piece of tape in the middle, empty on one side, so that's a dirty side, and then wipe and put things on the other side. Some people will leave non-perishable things in the garage overnight, and as long as 6 to 12 hours have gone by, the virus can't really survive beyond that in most cases. So those are some thoughts. Do I always do that myself? I'm not sure. Yeah.
Jean has a really great question. Yeah. She's saying, if you have symptoms and we're told to stay home and isolate, she's saying tested negative at CVS, what is the benchmark level of symptoms where you should go to the hospital or call 911?
So that's, the quick answer to that would be if you are having trouble breathing, right? Any kind of respiratory distress or unusual symptoms like, and just a intolerable amount of fatigue or bruising or change in mental status or just drowsiness, something that suggests that something's not right. And the reason I'm saying that there's a quick answer and then a not so quick answer is that one thing that can happen sometimes with this virus is that you may look like you're breathing just fine, but when someone sticks a pulse ox on your finger, your oxygen level is low. I won't get into the details of that, but I would just first of all, I'm hoping that your doctor or the nurse who called you or your provider counseled you as to what to watch out for. But if you're having trouble breathing, Oh, there's something called, I think it's called a Roth test, which is, and you can probably Google that. Let me see if I can remember. So if if you can hold your breath and count to a certain number. So if you can hold your breath and count to like 10, you may be okay. But if you're starting to get out of breath at like 5 or 7, you should probably be concerned and call your doctor and see if they ask you to go to the hospital. A lot of insurance companies have been very generous and have been approving people having stay at home monitors for their oxygen and blood pressure and things like that. And so you may want to ask your provider's office if that is something that your insurance will pay for, and maybe have that to monitor. But if you're a fairly healthy person, large majority, over 80% of folks who do get infected get better.
You reminded me of that one day.
Yeah, most people get better. Yeah.
I like that tip of holding your breath and counting.
Yeah.
That's a good tip. Some people are saying they're going in stores and some of the workers aren't wearing masks. Some of the people aren't wearing masks. Should they be concerned? Should they shop somewhere where all of the employees are not wearing masks?
Yeah, that's a really tough one, because so it all depends on where you are and how badly you need whatever it is that you've gone to get. If you have your mask on and if you grab what you need, wipe it down and wash your hands, you should be okay. Why are employers not insisting that their staff mask? Difficult to answer. I think we still have some believers and some non-believers, and so and that will always be. Human beings are not all created the same, and so some of us have different viewpoints than others. It would make me uncomfortable. It would depend on what my choices are. If that's the only place that I can go get what I need that day, then I just need to be cautious about wiping that down and making sure I don't touch anything and then touch my face and, kind of infect myself that way.
Michelle's asking how we disinfect blood pressure cuffs and other things that we use in the exam room to make sure things are clean.
Yeah, so we have approved chemical wipes that are used to disinfect everything that we have utilized. We've had very few people really in the office setting at this point, which means we have been able to do this without any exceptions. I wonder how things will be when it gets busier, but the protocol is in place. The wipes are in every room, in every office, at the front desk. And so between use, a lot of the stuff that we use is disposable or covers, like, the thermometers have those plastic covers that are disposable. And also the pulse oximeters that check your pulse and your oxygen level can be wiped down. So everything is wiped down between use. That's the short answer. Yeah.
Thank you. Folks, we're running out of questions. If you have any questions for Dr. Chowdhry, send them in now so that we can make sure they get answered. One of the other things that I know that you and I had talking about was why should people limit their networks and how does that come into play? So we've talked a lot about sort of social distancing, but that contact tracing piece and really limiting the amount of people that you're around.
And also remembering that just because the governor says groups of 5 can congregate doesn't mean a different group of 5 every day. Like you meet 4 friends today and then another 4. Because remember, every single person that you meet has their 5. And so then think about all the potential vectors of transmission that you've brought into the picture. So if I go today and meet 4 friends who each have a family of 4 or 5 or 4 or 5 people that they meet every day, now I've potentially exposed myself to 25 people.
Right. That's tough.
So that's, yeah, go ahead.
Is there anything else I don't think we have any more questions tonight, but is there anything else that you want to make sure that people know or are aware of? What should we be looking forward to as things progress, the reopening phases progress? How do we stay diligent?
I try I try to stay optimistic myself. I have kids, who didn't get to finish the school year, or didn't get to have a graduation or prom and things like that. It's very disappointing, but it's also a time to remind ourselves that you know we're resilient, we're strong, and we're going to get through this. There's been pandemics like this before, and they've come and gone. The idea is to get through this with the least number of lives lost and the least number of beyond what has already happened. I'm very aware of people who have lost their jobs or loved ones, but sooner or later there will be either a cure or a vaccine, or things will slow down, or we'll just get good at this. We know what we need to do to stay protected, and so if it means that for a little while we can't be exactly who we were prior to December of 2019, but we get to live and go past it, and all of that is kind of something that we have to keep in the picture. This is not going away soon, but we will adapt, and we'll find a new normal. That's the way I look at it.
That's a good way to look at it.
Yeah. And everyone's studying this, right? All the money, all the research, all the brilliant scientific brains, that's all they're doing right now, trying to find us either a cure or a vaccine. It's going to happen.
I know Ashley's asking some questions about getting back in to see the doctor. Ashley, as Dr. Chowdhry said, I think it's best to call and speak one-on-one with your provider about your specific circumstance. David,
I would say to Ashley one more thing, and if she's a Thundermist patient, just remember that if you're really struggling, and you don't think that you're getting the answer that you need, call again, ask for an explanation, ask for maybe a manager to be contacted, because maybe your situation is a little more complicated, or anyone else. There are always exceptions. So just be persistent. If you're really feeling like your needs are not being met, just contact the office and see if they can make some kind of adjustment for you.
David's asking about the accuracy of the tests.
So there's two kinds of tests, right? The one that you get done to know if you're currently infected. There isn't one single number, because there's so many different kinds of tests out there. It's not 100%, that's for sure. It's not 90% either. So we may be missing some cases. And so in those situations, we like to say, let's test again. If it's been a few days, your first test was negative, you're still not feeling good, you probably need another test. Because in a test that's not 100% reliable, if you get more than one test, it's a little more reliable.
We have a question. People talk about taking vitamin C and D3 as a precaution. Is that safe to do?
Those are great vitamins. Outside of any reason why you shouldn't be taking them, vitamin C has been recognized as something that boosts the immune system in moderation within the prescribed dose. And vitamin D, that's like my favorite in the entire world. It's the panacea of all evil. If your vitamin D level is nice and high, you have more energy, you have better mood, you sleep better, your bones are healthier. So as long as, again, even with good things, everything in moderation, mega doses of vitamins is never good for you, for all vitamins. So if anyone promises you that you'll take 10,000 units of something that you only need 100 units of, don't fall for that. So within the prescribed dose, both vitamins are usually health promoting. I'm not saying that they're going to prevent COVID, but they will help your immune system fight any infection that you might get. So they're pro-health.
Jean's wondering if there's anything else we can be doing to help our nursing home residents.
Yeah, that's a really, really tough one, right? So I think that's a situation, and I know that the Department of Health is on top of this. I think I heard not long ago that there's 85 assisted living facilities in the state, and every single person in every single facility has now been tested. And the staff in those facilities will need to be tested frequently as well. It's just such a vulnerable population. And I know people miss seeing their parents and their loved ones, and it's such a difficult thing to go through. But the best thing you can do for your loved one right now is to not visit, but stay connected in other ways, through phone, through FaceTime, different things. So for the ALFs, for the assisted living facilities, for the nursing homes, the best thing that we can do is, test everyone, test frequently, which is what's happening.
Mm-hmm. Priscilla's asking about populations that are high risk. So she says, for asthmatics and people with COPD, would you suggest they stay working from home until it's safe?
Again, not all asthma is of the same severity. Not all COPD is of the same severity, but it is. These are conditions that have been recognized as putting you at higher risk. So it would be something that you would have to talk to your doctor. So if your employer requires a note, your medical provider has to be involved in the conversation, because there's different stages of the disease that increase one's risk. And so it's true that if working from home is possible for the patients with the high risk conditions, then that's what should happen.
How long do you think realistically we're going to be living differently?
That's a tough one. So, there's different, when you look at or listen to, some of the vaccine timelines, it's very disheartening, right? Because someone says a year, someone says 18 months, and you're like, what are you talking about? But there's different phases of clinical trials where they study if it's safe for humans, is what dose is good for humans, and then trying to compare it with different other things. Because remember, we've also gone through this whole in the last 2-3 months, how many cures have been purported, like, oh, this is going to fix it, take this, take that, and then it's panned out to be nothing. So similarly, when it comes to vaccines, it's going to be a little while. It's tough because there have been other viruses like corona that have just come and gone and just disappeared, but it might not be the case with this one. In which case we just have to wait patiently and live differently for a few months. And I'm not sure. Some people think that things will slow down and then pick up again in the fall when the flu comes back. But having said that, warm countries, warm weather doesn't really slow this down. We're seeing enough of this all over the world in very hot climates as well. So I wouldn't hold my breath thinking that as summer comes, it's going to die off, because I know a lot of people say that. I don't think that's going to happen. But that's just seeing that there's very warm countries, very hot climates where the virus is still able to survive.
Amanda's saying that she has a large family. So in those circumstances, how do you best quarantine if you need to quarantine after testing positive?
Yeah. So, ideally you want to be in a separate room, but otherwise, I guess if that's not an option, then you just have to mask all the time the person who's infected, and then try to maintain your distance from the rest of your family. This could be a situation in which, Amanda, I don't know if the state has any resources. Sometimes they have ability to quarantine. I wonder if they could call the COVID hotline and see if there's any help available, because there are certain situations where quarantine outside the house in a different location can be done, but then that's different for different situations. It would be tough because ideally you're supposed to not share a bathroom and not share a room, and that may not be practical. So you may want to call the COVID hotline at the Department of Health and see if there's any help for you.
Amanda's also asking, she's saying, I have COPD. Will wearing a mask hurt my health more than benefit it? I know we talked a bit about masks before.
Yeah, because, you basically need to think about it more like a face covering than a mask. And just remember that you mask to protect people around you in case you're infectious. So it shouldn't have any impact on your COPD.
And April's wondering, are people with COPD or who have diabetes still at high risk for COVID-19?
Not at high risk for the virus itself, but high risk for developing complications and not recovering quickly from it. So it's not like having high risk conditions makes you more likely to get the infection. Because the virus doesn't spare anyone. It's very contagious. That's whether you have a great immune system and no health conditions, whether you're 18 or 80, it's going to get you. But the possibility of having a complication and getting sicker with the virus goes up with a high-risk condition.
I think Debbie joined us. Debbie was one of the first questions we had that had come in earlier, and I think she missed your response. So I just wanted to circle back and see if we could get her answer. She was the person who had tested positive in March and was still seeing symptoms.
Right. So I think my answer for you, Debbie, was that you shouldn't be feeling this unwell this long after the infection. I wasn't sure if you had a subsequent test that was negative. So I think you had a two-part question. You wanted to know if you could still be contagious, and my answer to that was if you had a positive and then a negative test, once you've turned negative, you're likely not contagious, but you should be calling your provider's office to figure out what's going on with you in case what you're experiencing is a complication from COVID-19.
Well, thank you, Dr. Chowdhry. Thank you, everybody, for joining us tonight. We were really happy to have you with us. We thank you, Doctor, for all of your time, and we hope that everyone has a great evening.
Thank you, Amanda. Thanks, everyone.
Thank you.
Stay healthy, stay safe.